Namaste. I am Miss Alyssa Rebello, a psychologist at the Cross Disability Early Intervention Center of AYJNISD National Institute of Speech and Hearing Disabilities, Divyangjan, Mumbai. My topic is play therapy, and this video focuses on understanding play and its therapeutic nature. Play is at the heart of childhood. It is a dynamic process that enables children to express themselves in their own ways, to get in touch with other children, to become socialized. Children love to play because it's fun, but it is also important for healthy development. During different types of play, children practice key social, cognitive, physical, and emotional skills. Play, as a free and effortless expression of life, is important for the children because they can develop their imagination and creativity through it. It is a way of exploring and getting to know both the inside and the outside world. It is a basic part of children's development. Let us look at the types of play for children. Children will participate in many different types of play as they grow. This includes the 6 stages of play outlined by sociologist Mildred Parton in 1932. Unoccupied play, solitary play, onlooker play, parallel play, associative play, and cooperative play are the types of play. Newborns from 1 to 3 months old will participate in unoccupied play. Think of it as their first attempt to learn about the world. They'll observe their surroundings and make random body movements out of curiosity. Unoccupied play might not actually look like playing, but it sets the stage for future development and future play. In solitary play, children don't pay much attention to playmates in social setting. They rather engage in solo play. Around 2 years old, toddlers engage in onlooker play. This involves watching others playing but not participating. Parallel play. Have you ever noticed a group of toddlers playing side by side but not together? They are engaging in parallel play. Kids might use the same toys and mimic each other, but they won't directly interact with their peers. Associative play. Around age 3 or 4 years, children become more interested in actions of others. They'll begin engaging with their peers while playing, but they'll still do things mainly on their own. Cooperative play. This is when children finally start playing with others. It is essential for social and emotional development. Let us see what is play therapy. Virginia Ackline defines play therapy to be based on the fact that play is the child's natural medium of self-expression. It is an opportunity which is given to the child to play out his or her feelings and problems. Play therapy is an effective means of responding to the mental health needs of young children and is widely accepted as a valuable and developmentally appropriate intervention. According to the Association for play therapy is a systematic use of theoretical model to establish an interpersonal process wherein trained play therapists use the therapeutic powers of play to help clients prevent or resolve psychosocial difficulties and achieve optimal growth and development. Brief history of play therapy. The importance of play, and particularly its importance in the life of a child, has been documented for many years by famous philosophers, educators, scientists, and psychologists. The Greek philosopher Plato once said, "You can discover more about a person in an hour of play than in a year of conversation." The famous Sigmund Freud was the first to publish a documented case on the therapeutic use of play titled Little Hands. Other psychologists like Melanie Klein and Anna Freud also began to implement play therapy into their psychological practice with children. They utilized play therapy to analyze children's emotional and behavioral lives. Carl Rogers initiated a new model of psychotherapy that is called as client-centered therapy, later termed as person-centered therapy. With this approach, Virginia Ackline developed a new approach to work with children and which was known as a non-directive play therapy. Utilizing the person-centered theoretical foundation, Ackline devised a clear play therapy theory. In 1935, Margaret Lowenfield first published Play in Childhood, documenting her in-depth observations of children while working at the clinic for nervous and difficult children in London. The philotherapy was developed in 1960s. It became popular in the world of play therapy. It is a psychoeducational family intervention in which the therapist trains and supervises parents in play therapy session with their own children. Let us understand the therapeutic nature of play. Charles E. Schoffer has discussed the therapeutic powers of play in numerous published works. He points out that play helps overcome resistance to therapy. Play serves as a developmentally appropriate means of communication. In play therapy, the therapist follows the child's lead through play, and the child expresses thoughts and feelings that might be difficult to communicate otherwise. Play provides an excellent opportunity for the child to have fun, and during this time, the therapist has the opportunity to observe the child, understanding the child's development of socialization and building relationships with other children. Play facilitates the child's ability to develop mastery that leads to a sense of efficacy and competence. During play, children are self-motivated. Play also assists in the development of creative thinking. Creative thinking is the basis for problem-solving skills. Play offers a means to discharge strong emotions, bringing relief. Play also encourages socialization. Types of play therapy: directive play therapy and non-directive play therapy. In directive play therapy, the therapist sets out with specific interventions and goals in mind. During the play sessions, the therapist knows where they want to take the discussion. Often, toys and activities are chosen ahead of time by the therapist, and they will initiate play situations that attempts to lead the child to discuss the problems at hand. In non-directive play therapy, the therapist allows the child to take the lead. The therapist is flexible and is willing to go where the child's play takes them. By doing this, the therapist makes room for the child to reveal what is troubling them in a natural manner. The therapist doesn't set the parameters for the session. They don't try to guide the child into a pre-planned conversation. Rather, as the child acts out scenarios or makes up stories during play, the therapist follows their play theme. The goals of play therapy. The primary goal of play therapy includes helping a child in minimizing his trouble and overcome negative feelings. The other goals of play therapy are to help the child experience and express their emotions, cultivate a sense of empathy towards oneself and others, learn new social skills, and develop a sense of self efficacy. Let us look at some of the play therapy techniques. First is the sand tray play. In sand play, children are given a tray filled with sand and miniatures to create scenes projecting their inner thoughts and emotions. The therapist observes, takes notes, and engages in discussion with the child, allowing the free expression of unconscious feelings. While sand tray offers a visual and tactile avenue for self expression, therapeutic storytelling strategies provide a verbal and imaginative pathway to uncover and address a child's inner experience and emotions. Children are provided with story stems or beginnings, along with puppets, toys, stuffed animals, or figures to act out a story. This technique allows children to achieve catharsis and healing by projecting experiences and feelings onto characters, enhancing communication skills. Role play. Role playing involves acting out various real life situations, often with puppets or dolls, representing the child and others in their life. This technique enables children to work through challenging relationships, practice responses, build confidence, and explore different perspectives. Creative arts and craft in play therapy. Incorporating creative arts into play therapy can significantly enhance a child's ability to express complex emotions and experiences through various mediums such as drawing, painting, and sculpting. These artistic expressions provide a safe outlet, encouraging emotional release and self discovery. Children are given art supplies like paint, clay, crayons, and beads to freely create. This process aids non-verbal and verbal expression, helping children discuss their artwork to build communication skills. Art and craft contribute to focus, self-regulation, and there are some more play therapy techniques which include block play, puppet play, clay play, sensory play, use of music and movement in play therapy. These techniques can empower a child through safe expression of feelings, practice of social skills, understanding different perspectives. They learn coping mechanism within a secure environment, fostering emotional growth in a way that's both effective and deeply respectful of a child's inner world. Why use play therapy? Play therapy is a form of therapeutic renewal guided by a therapist. Play therapy can be used for a multitude of reasons, from emotional distress to behavioral issues. Through play therapy, children learn to communicate with others, express feelings. It helps modify behavior, develop problem solving skills, and learn a variety of ways of relating to others. Play is a way of de stressing, a way to be creative and imaginative. Play provides a safe psychological distance from problems and allows expressive thoughts and feelings appropriate to the child's development. Play therapy is a developmentally appropriate approach to intervention in children and has been shown to have beneficial therapeutic effect. By creating a safe holding environment in the playroom, children can communicate through fantasy, imagination, and displacement. Well, lastly, as Jerome Singer says, play gives children the opportunity to search for and experiment with alternative solutions to their problems. The video gives a brief understanding of what is play and play therapy. But if you want to understand play therapy in detail, you can refer to these references of journals, websites, and books that are mentioned. This will give you a deeper understanding of play therapy, its practices, issues, and current trends. Thank you.